Hello and welcome to GRTV's MPO Showcase. I'm Julie Way from the Community Media Center. In this episode, we'll be speaking with Joanna Rodriguez and Cori Anderson from Spectrum Health, Healthier Communities, Programa Puente, and the Fit for Life programs. Hello, welcome.
Thank you.
Thanks for joining us today. Can you just describe what your programs are? And Joanna, we'll have you start with talking about Programa Puente.
Great, thank you. So Programa Puente was launched in 2000 as a free wellness program directed to the growing Latino population of Kent County. And it is a prevention program for prevention and early detection program for cardiovascular disease as well as diabetes. And so the objective of Programa Puente is to reduce the incidence of coronary heart disease or diabetes within the Latino population.
Very good. And Cori, what about Fit for Life?
Sure. The Fit for Life program is actually a new program that we're launching this year, and this will be accomplishing the same goals as Programa Puente, but focusing more on the African American and Native American populations of Kent County.
Very good. And both of your programs are programs through Spectrum Health's Healthier Communities. Can you talk to us a little bit just about the Healthier Communities projects and what they do?
The Healthier Communities program, or Healthier Communities Department, is part of a $6 million venture that we have received each year. And these monies are used to serve the underserved folks of Kent County. We do community outreach and programming, specifically with some other programs. We have the Core Health program, which works with folks that are diagnosed with cardiovascular disease and diabetes, as well as COPD, and the Moms program that works with moms of new babies. So we do a lot of community outreach and focus on the underserved in Kent County.
Very good. I would love it if you could speak a little bit to, we're targeting specific populations with these programs. Can you talk about what the need is there and why it's so important to kind of target those populations?
Well, within the Latino population, it is growing in numbers as far as incidence of heart disease and diabetes. And so, again, we are trying to avoid these diseases, and through that we do it by teaching them how to practice healthy behaviors, heart healthy behaviors, and to learn what their own numbers mean. Numbers meaning their lipid profile, which includes cholesterol, LDL, HDL, triglycerides, their blood pressure, and their blood sugars.
Very good. So those are some of the kind of goals that the program looks to accomplish.
With Healthier Communities, our primary goal is to reduce the onset of disease and/or provide self-management skills, because we know that folks, do best when they're in their homes and able to take care of themselves. So really, it's to reduce those things that come from those diseases and to make sure that we're reaching where they're at. And we do a lot of these things with community partners and whatnot too, so that we can provide the best interventions possible.
Very good. So how do you go about accomplishing these goals? You've talked a little bit about, we go into the home, a place where they're comfortable, but what else do you do to work with them to, again, know what those numbers mean and start developing those healthy habits?
Well, we go out into the community and we provide on-site screenings, and that is to include the blood sugar testing, the blood pressure testing, cholesterol testing as well. After that, depending on their risk factors, we will see them every year for a screening, or every 6 months if they're at a higher risk category. We also provide interventions such as physical activity, and again, working with our partners, and some provided through Spectrum Health and Programa Puente. And they could be anywhere from cardio, kickboxing, Zumba, yoga, and those are provided. We have times in the afternoon, times in the evenings, Monday through Friday pretty much. We also provide nutritional classes, so cooking classes, cooking with the chef we've done in partnership with the Downtown Market, and also Cooking Matters through the YMCA. And I provide, and the other nurse that I work with, we provide a Know Your Numbers class, and so we go into more details about what these numbers mean and what you can do to maintain them or reduce them, and therefore reducing your risk factors.
Very good. So these are programs that are offered, like you said, throughout the community, like at community organizations or other places like that?
Correct.
Our goal is to meet the individuals where they're at. So what's the most comfortable location? So different locations that are right where they would be comfortable going to and that are convenient to go to also.
Yeah, absolutely. All right, well, I understand that you're going to tell us a little bit about your clients and what their needs are. So if you can just kind of walk through what an experience for a participant is, kind of from where they get started and what they know and what they might not know, and go on from there.
Okay, so our clients know through us either word of mouth or newspaper advertisement, radio advertisement, and we're talking the local Spanish newspapers and radio stations. Also through the churches that we've gone to provide community outreach. And so when they come in, they schedule an appointment. They have to come in fasting, so 12 hours fasting, nothing to eat or drink. They come in that morning. We do an intake, and at that time, we give them the results of blood pressure, blood sugar, and cholesterol, triglycerides, LDL, HDL. And so depending on that, those results, then we advise them on what they can do to better those numbers, or we talk more about what they are doing right and if they are good numbers and to continue that. We then invite them to the Know Your Numbers class, where we will talk more in detail about each of these things and why it's important to our bodily functions and why it's important to also keep them low. And then after that, we also invite them to the physical activity classes. And so we've had one participant that came to us, and he says he had no idea. He had no idea what this meant. We went to his church. And so he came and he said he had the screening, and he was like, okay, these are high, let me come to this class so I can learn a little bit more. And so we talked about labels that day and what portion sizes meant, and he was like, I had no idea what a portion size was. I thought, oh, that's 100 calories, but I had no idea that there was 16 servings in that one box. So he was very grateful to know that. We also talked about the My Plate and the size of that. And so he says, when my plate's at home, I had to come home and I had to reduce my plate sizes, I had to reduce my glass sizes, all in order to get good portion control. His blood pressure was elevated. He wasn't exercising. He started to walk. Then he received, through a scholarship from the YMCA, a membership for a year. So he started attending the YMCA, and he lost 20 pounds. His blood pressure was reduced from hypertensive stage to pre-hypertension, and so and he was able to talk to his wife and kind of get his wife on board, and so and bring it down to the family too, to his kids, to eat healthier and exercise and make your numbers better.
Very good. It's so cool that he's able to see those results. Like, I'm losing weight, my blood pressure has improved, but then to be able to involve his wife and kids, and that's going to have impact for generations. Learning how to eat and cook healthy, those are important things, and maybe we're not taught in other ways. So really great outcomes it sounds like you're getting through the program. And on top of kind of the numbers piece, it's really a support system too, it sounds like. They're working with a nurse. What does that piece kind of look like?
So if well, depending on the results, again, if they have anything that's elevated, we have a protocol of when to call them, so they get phone follow-up with the nurse, as well as anytime they want to call and have a question, they can always call us. We're accessible to them to answer any questions that they have. But we also do that piece on the phone of, how are you doing? How are things going? How can we help you meet your goals? What other information can we provide to you for you to be successful?
Very good, and I think always nice to know, hey, there's somebody I can call and ask my questions too. So you've talked a little bit about the referral. Sometimes people just kind of hear about you, but how does the referral work? How can they get signed up? Do they need to speak with the doctor first, or what's best? Not
at all. It's self-referral, so they can just call our number at Programa Puente, and same for
Fit for Life.
Fit for Life. And so they're scheduled an appointment.
And they both are, Fit for Life and Programa Puente are 3-year programs. So when they enroll in that first initial screening, they're actually going to go into a track based on their results for either wellness track, where things are looking great and let's keep them great, or prediabetes or pre-cardiovascular disease. So their journey starts that first day with their first biometric screening, and then like Joanna said, based on the screening, they may come back in 6 months or they might come back annually for that biometric piece. But through that 3 years, they're engaged in different activities and interventions that deal with the nutritional wellness and physical activity and health literacy that Joanna's talked about too, so that they're continuously engaged in different opportunities for them to learn more.
Yeah, sure. And 3 years, I mean, that's enough time to be able to, establish a lifestyle type of change and, again, make sure you're getting that support and that things look good on the medical side too. So very good. What else should we know about Fit for Life? You're getting ready to kick off, so tell us more.
We're just starting to launch our program. We will mirror exactly what Programa Puente said, but we will be reaching folks in the English-speaking world, so that the classes will be exactly the same but be done in English. We're working with some area churches to provide these screenings, and again, they'll be at locations that are convenient for folks. We'll be launching a little bit later this year. We've been getting some great feedback and outcomes from Programa Puente, so we certainly have learned from them and are moving forward with serving the African American and Native American population.
Great, and great that you're able to kind of expand what that service is.
Absolutely.
And I think it's important to note too that Programa Puente, your staff is bilingual, correct?
Correct.
So
yes, so we have a staff of 9 and all bilingual, 2 RNs, 2 project coordinators, 2 community health workers, and an administrative project coordinator.
Very good.
Supervisor.
Really meeting people where they're at. So that's a great thing. All right. Well, in wrapping up, tell us where our viewers can go to learn more information, especially if they want to join or get started with the program.
So Programa Puente has a Facebook page, so you can find it at www.facebook.com/sh Programa Puente.
Very good.
And we're just kicking off, so you can reach me at the phone number provided, which is 391-3990.
Very good. Well, thank you both for joining us today, telling us about your programs and for the work that you're doing to just help people in our community stay healthy.
Thank you.
Thanks for watching today.